So today's Cardinal lesson is about Medicare's annual enrollment period, abbreviated AEP, which is going on right now. I mean, they told us all the numbers October 1st. We can't actually write one of these policies till October 15th, but that's just around the corner. And what we're going to do today is we're just going to talk about this and what in the world is going on. So I want to bring Tom on, and Tom's going to talk for a second here.
Yeah, I mean, this time of year is important for Medicare. You're going to start seeing a lot of ads on TV, getting a lot of mail about it, and you need to know what options you have, what choices you need to make. Because if you miss this time of year, you might be stuck in that plan for the next whole year. But what's often people miss is they don't know what their choices really are. They don't know what decisions they have to make or what decisions they don't. And so we want to go through today, walk you through sort of what this time of year means for you, what choices you have or don't have, and then go forward from there. So let me bring up the show notes. We have these at the link below the video. They're also on our website. As always, we have the board, and then this document, and Hans will talk about this a little bit more as we go through, but this is a document that we would need to have on file prior to us meeting to talk about certain types of these plans, drug plans, advantage plans, that type. But this is pretty standard. I will say, if you are reviewing your drug plan or your advantage plan and you're not signing something like this, the person doing this is not following the rules as they should. So just file that away in the back of your mind. This is something that everyone is required to do when handling some of these plans. So let me turn it back to Hans. We'll go through this board and show you what you need to do this time of year.
Yeah, and we could do that form for you in all 50 states and the District of Columbia. This stuff is federal, and we're licensed for insurance in all 50 states and District of Columbia. We can do that form by text. So it just takes a second for you to sign it, or a minute, is a better word than a second. And we can handle all that with you if you just call us or write us or that kind of thing. So okay, what in the world's going on? And people, in my experience, are confused because they don't think about this stuff all year. They just know that's something you do in the fall. And if you're on Medicare, most people at least know, boy, I got to do something. I'm not exactly sure what it is, but I know I got to do something. What is that? And other people are pretty well informed on it, but it's a big period of confusing. And generally, the only place you hear about it is in advertisements, on TV. You get a lot of direct mail. You're listening to the radio. You have people calling you, which they really shouldn't be doing. We can call you if you're one of our customers, but it's against the rules for somebody to solicit for this stuff unless you've invited them to solicit. So in any case, people's information about this is just kind of from all different places. People are talking about it, social groups that you belong to. So what we're going to do today is just kind of outline how this stuff works. So what you can do from October 15th to December 7th is you can, if you're on a Medicare Advantage plan, if you're on one of these plans and you want to make some changes, you can go back to original Medicare. This is the time of year you could dump this, go back on original Medicare, and then you'll need to purchase a Medicare supplement policy. And you can do that from us. And we will offer you a Medicare supplement. And if you've been on this for more than a year, and you're going to have to answer health questions to get this supplement. So if you're going to make this change of leaving Medicare Advantage and getting a supplement, you're probably going to want to get this part of it taken care of first, which is you're going to want to answer the health questions, or at least look at them and make sure you can answer them. We represent, besides these companies for Medicare Supplement, we have about 30 other companies. So they all have different questions. So this is something we can help you with, is look in and make sure we get you with a company that's going to accept you in your health conditions. So that's one of the problems of going this direction, of leaving Medicare Advantage, getting back on original Medicare, and then the problem comes in is in purchasing the supplement. you're going to need a professional doing that and making sure you can get on with the right company at the right price. The other thing you can do is if you're here and you have a supplement and you've just been going along, you've got original Medicare, you've got a Medicare supplement. A lot of times it's a Plan G or a Plan F or a Plan N, and you're there, and perhaps this has gotten very expensive for you. You're paying a big monthly premium, and it's been going up and up and up, and you want to evaluate going on one of these Medicare Advantage plans. Well, so you can also do that with us, and you will need to call us. Remember, we can't call you unless you have one of these policies with us. You're going to need to call us, and we're going to fill out that little form. And then after we fill out that little form, we're going to look through and go over these Medicare Advantage plans with you and find what will be the right one for you. And a lot of times we're going to search the doctors you already use and make sure that they're in the network. I mean, there's a lot of work we need to do to help you make the decision of what company and what plan you're going to buy it from. But if you just want to evaluate that, the reason people might do that is you can dump your supplement then. You'll have to dump your supplement, and you'll also dump the premium if it's gotten quite expensive and hard for you to do. Many of these Medicare Advantage plans come at a zero premium or a very low premium, like $31 a month was a guy I talked to yesterday. Um, so, so you can go this way, you can come back this way. You can also, if you're over here on the Medicare Advantage plans, and let's just say you're with Humana and you haven't been real satisfied with the plan or how it's working for you or the doctors that are on it, and you just want to look at moving to another company. You want to look at going with United Healthcare AARP or Aetna CVS or WellCare or Cigna. I mean, however you want to do that, you could, during this time of year, you can change from one company to another company. And same thing is if you're over here and you're with one of these Medicare supplement companies on a Plan G or a Plan F or a Plan F, and you wanted to make a change, you can actually do that 365 days a year. So there's nothing special about that. But a lot of people, that's one of the misconceptions. But it's fine if you want to do this evaluation right during the year. So, I hope I haven't moved you around too much, but it really, what they open up from October 15th to December 7th is the ability to move your situation within Medicare. And when you go on Medicare Advantage, you don't need to answer any health questions. So this comes. So if you're stuck on one of these Medicare supplement plans and you've had it for years and the premium has just gotten so high that you don't want to deal with it, and you've been told you can't move to another company at a lower premium because of your health, an option for you will be to take a look at Medicare Advantage plans, and you won't have to answer any health questions. Now, I want to bring Tom on. I got more to cover, but just on what I've gone over and moving around in the enrollment, I want to bring Tom on to just add a few words.
Yeah, I mean, I think Hans had mentioned this, but one of the most common misconceptions that we see with people is really around the Medicare supplement, right? They have a Medicare supplement, they're on this left side of the board, they have this drug plan, and they think that the only time of year they can switch that supplement is this same window, October 15th through December 7th, which is inaccurate. You are able to switch a supplement at any point during the year. You just have to go through the health questions, right? You have to qualify through underwriting. But a lot of people think, oh, this is the only time of year I can switch, and it's not true. Now, what is true, and Hans had just talked about this, if you're on an Advantage plan and you want to switch Advantage plans, this is the time of year you have to switch that. And then that's good for the next whole year. Same thing with the drug plans, right? The drug plan this is the time of year if you want to switch a drug plan, it needs to be done between October 15th and December 7th. And that change will happen January 1st of the following year. So this year will be January 1st of 2025. And so I just want to make sure people understand that. So, if you're looking at changing, wanting to review it, really the ones that are time sensitive are the drug plans and the Advantage plans, and making those changes needs to happen during this time of year. So if you can understand that, I think we've succeeded in part of the what we want to go over in this video.
Okay, so, a lot of what I've just been talking about is you are either here, or if you're not here, you're here on Medicare. And, I could draw a line right down the middle of the board. You can't be both places. And that's a big area of confusion. Now, what I want to point out is and Tom just pointed this out, is what you can change from October 15th to December 7th is Medicare Advantage, whether you're on the program to begin with or you can make changes within your plan. That's if you're here. And if you're one of these people that are over here, of course, I just went over this, is that you can go from original Medicare to a Medicare Advantage. You can do that during this time of year. But if you're here, you still have this October 15th to December 7th going, is that you can change your Part D plan. And if you want to change your Part D plan, you can only do that this time of year. So most people are not aware about this till they got their nice little letter from the insurance company, which our producer for the show told us he just got his this week. And it's this kind of long letter. It's the annual notice of change letter, and it's pretty long. And what they're doing is they're informing you either your Part D plan or your Medicare Advantage plan, which includes a Part D. They're sending you a letter saying this is what's changing about your plan for 2025. So they're giving you notice, and a lot of people have difficulty reading and understanding that letter. We can help you with that if you need help with it. But the thing that's caught people's attention this year is there is now a cap of $2,000 out of pocket on your behalf if you have a Part D drug plan, which is most people on Medicare have a private, separate Part D drug plan by Medicare. And before this coming year, you could have a very large out of pocket, and that would come from co-payments, the deductible, but mostly co-payments and percentages of the drug that you had to pay for. And it really happens for people on very expensive drugs. And I've seen people with cancer drugs or autoimmune drugs that are $10,000 a month. I mean, that much. And people are on Medicare, on a Part D plan, have had previously, and including this year, a very large out of pocket in that situation. And even people that aren't on cancer drugs, people that are on Eliquis, or I'm just picking a few drugs out that are notoriously high, people that are on Ozempic and for diabetes, and it's covered by Medicare, their out of pockets are huge. And so in the Inflation Reduction Act, a year ago or 2 years ago, I think it was a year ago, 2 years ago, whenever that was passed, Medicare was a little add-on. And so they threw on, to make everybody like the whole bill better, they just tacked on a Medicare benefit that sounded great at the time. And it is great for people that have these massive drug plans costs on Medicare Part D. They threw it on and they just said, okay, the most a consumer can pay out of pocket is $2,000 if they're covered on an annual basis, if they're covered under a Part D plan. And so without putting up any money for it, because it would have been great if the government would have said, okay, and by the way, this is going to cost another $1 billion a year or 500 million or whatever the number is. And so we're going to just put up the money for this. They didn't do that. They just passed the rule, and they waited till this summer for the insurance companies. All of these insurance companies right here have to go to Medicare and say, okay, this is what we're going to charge for our Part D plans in 2025, now that we got to start paying 100% of drugs once in time. And they were all just shocked. I mean, it was just, I heard numbers like $175 a month, $150 a month was the premium that the Medicare Part D company was going to charge you, the consumer, and in many of these plans, they were charging either zero or $5 a month or $20 a month. $150 is a long way from there. And so immediately the government just said, whoa, we can't do that, especially in an election year. We can't be sending all these people bills from the private insurance company for $150 a month for something you were. So anyhow, they went back and forth for a few weeks, and they arrived at a more reasonable number. But it's a phase-in deal, so I don't even want to talk about what's going to happen in 26 and 27. But basically, they've made Part D much better. The government has for you, the consumer, that's on a Medicare Part D plan, and they didn't put up the money to pay for it, and they thought that the insurance companies were just going to bear the cost. They're not. And so the government came up with some money in the 11th hour and so made these raises more palatable. But we're getting calls right now in our business from our customers that have gotten some pretty significant rate increases. Just they got that annual notice of change letter, and we're here to deal with this, but I'm just giving you on this video, this is a big deal this year, and it's going to be a big deal for a couple, 3 years, is that the cost of this for Medicare Part D is going way up. Now, what I'm going to tell you is almost every one of these Medicare Advantage plans has a Part D drug plan just attached to it. I mean, it's just there, and it's included for the zero premium or the low premium. And the insurance companies are in the same boat with this, as they got to come up with the more money to give this, to pay 100% of drugs once you've paid $2,000 out of pocket. So with a Medicare Advantage plan, what we're seeing is they're trimming benefits. They're looking for ways to cut costs, and they've been successful at that. But just you're going to need to read the letters and look at the benefits on this, because somewhere they've buried the additional cost, or they've just gone to a premium. So this year, a lot of consumers don't really know this. They haven't been that straightforward. And a lot of times this stuff is brought to you not by independent agents like us, it's brought to you by somebody representing the company. So they're just going to go at you with whatever that one company is offering. So that's kind of a long-winded approach, is that this thing has a shadow over the whole thing this year of what's going on. And it's not as bad as I'm making it sound, because a little trimming and a little bit of this on the benefits on this, and a smallish rate increase. But if you go, I had a guy yesterday I was talking to, he went from $5 a month to $32 a month. That seemed like a pretty big rate increase to him. And then once we got through talking to him, he's just going to tolerate it and go for it. But he is going to consider moving to one of these things, because that would just take his premium to zero, or not to zero, because the one I was showing him was $31 a month. But he'll be able to dump his Medicare supplement and that $34 a month Part D plan. Now, I want to bring Tom back on, and I know that Tom has something to add to that.
Yeah, I mean, I think one of the things that we haven't spent a lot of time talking about, and we have other videos on this, but it's like, why would someone choose the left side of the board, the Medicare supplement and a drug plan? And why would someone choose the right side of the board, the Advantage plan? And so I think it's important to hit on some of the differences there. One of the nice things about the supplement, again, now this is the left side of the board, is there's no networks. You can see any doctor that takes Medicare. You can go to any hospital that takes Medicare. That is a real benefit of those plans, of just not having to worry about, does your doctor take this? And that's different from the right side of the board, the Medicare Advantage plan, that you do have networks, right? You have to worry about, does my doctor take this plan? If I want to go see a specialist, do they take my plan? I mean, so that's a real difference there. And then the premium, right? The supplement on the left side, it's more expensive. There's a cost depending on your age, depending on your state. It can vary, but between $100 and $200 a month is pretty typical for these supplements. The Advantage plan, a lot of them, like Han said, are $0. I mean, there's some difference there, and so one of the things that a lot of people end up with is they meet someone right as they're turning 65. They typically are either in the Advantage Plan camp or the supplement camp. I mean, there's sort of a debate in our world about which one's better, which one's worse. In our opinion, there isn't a better or worse. They're just different, and one can be right for one person, and one can be right for the other person. And so, when you're making that decision, look at both sides of it, consider both options, and that way you're going to make the most informed decision and be in the best spot for you, not necessarily what your neighbor's doing or what your brother-in-law is doing. It's really what is specific to you, what makes the most sense for you, and we can help with that if you have some questions there.
Okay, if you want help with this stuff, call us. We're licensed in all 50 states in the District of Columbia. If you would like to text us, you can send a text with your information to this number. You can also write by email to Hans@cardinalguide.com, and we'll take an email and we'll respond to you. And you're going to have to sign that form that Tom showed you earlier, the scope of appointment form, and you can find that in the show notes if you want to read it. You can just click on those and read the thing. But if you get in touch with us, we're not a call center. We're a small family-owned insurance agency that's, again, licensed in all 50 states and DC. We have consultants that will work with you on the phone. This stuff is very highly regulated, and so we spend a lot of time getting ready for this time of year and making sure our staff, follows everything they need to do by the numbers. And, we'll give you consulting on either moving from where you are or making changes from within where you are. So I want to bring Tom back on. I'm Hans Scheil.
And I'm Tom Griffith.
We thank you very much for listening.
Thank you.